CFBHN is a not-for-profit 501c3 corporation contracting with community service organizations to provide a full array of publicly funded mental health and substance abuse services in 14 Suncoast counties. Services include acute care, residential treatment, housing, medical, outpatient, recovery, support, and prevention. And that's just to name a few. Our friends from CFBHN are next on Bayside. Good morning and welcome to Bayside. I'm your host, Shelly Sanders. I know I gave you a laundry list of things that CFBHN does here in the Bay Area, 14 Suncoast counties, like I mentioned before as well. Can't think of a better person to introduce to the show to tell us all about what they do here than Dr. David Clapp. Welcome back to the show. You have a new position with CFBHN, and that is the incoming Chief Clinical Officer. Congratulations on your promotion. And also you brought along with you Operation PAR Vice President John Essenberg. Welcome to the show.
Thank you.
It's a pleasure to have you guys here. You know, I mentioned a laundry list of things. It's literally a full array of safety net services to these 14 different counties as it relates to public mental health, safety, et cetera, et cetera. But why don't you just start yourself and tell us just the grand picture, the big umbrella. What exactly do you guys do, and what does it mean to call yourself a managing entity?
Well, Shelley, you did a very nice job of actually describing it. We are one of 7 managing entities across the state of Florida. And we were created by the legislature to manage the public funds for behavioral health care across Florida. Sure. So we manage annually, depends on the year, but about $200 million in substance abuse and mental health funds across those 14 counties of the Suncoast region and Circuit 10. And we use those to fund substance abuse and mental health treatments for 60-some providers from Pasco all the way down to Collier and all the way over to Lakeland. And Operation PAR, with John here, is one of premier providers.
One of the premier providers. And just so I heard you correctly, you did say $200 million that's allocated towards these 14 counties.
That's correct.
Wow, it seems like a lot of money, and I'm sure each county has a different issue, and even if you really microscopically broke it down per county, each little region of the counties have different issues to address, right?
That's correct, and that's one of the strengths of the managing entity model is that we work with each circuit, with each county to figure out what their specific needs are in that community and target those funds specifically to programs. Sure. Individual, unique programs to those communities. We have specific programs for jail reintegration. We're working with 2 of our counties with Marjorie Stoneman Douglas School Safety funding to provide mental health services in Hillsborough and Pasco counties in the schools and in home. We provide outpatient treatment for mental health. We provide medicated assisted treatment services for our opioid crisis, which I think we'll be talking about in a moment.
Absolutely.
And that's just to name a few, prevention services and and even supportive housing.
Sure, I was going to say, and we just barely scratched the surface. Really, we could have you on every week and still not talk about all the things that you do here in these 14 counties. So without further ado, John, let's talk about Operation PAR and how it is that you became a provider and how it is that you work with CFBHN and address those opioid issues.
Sure. So Operation PAR, being one of the providers in the Suncoast region that CFBHN covers, we work with CFBHN to try and use some of those funds to help indigent and uninsured or underinsured individuals with substance use disorder problems. The program that I run for Operation PAR is called Medication Assisted Patient Services, which is a program that provides medication assisted treatment for people with opioid use disorder.
And to give us an idea, give me the imagery of what that looks like. What do you mean by that?
So for individuals who are struggling with opioid use disorders, people who are addicted and physiologically dependent on opioid drugs like heroin, prescription painkillers.
Sure.
And for those individuals over time, it gets to the point where they can't manage the addiction any longer. And we are really what stands between them and either them becoming incarcerated, being hospitalized, or possibly overdosing and dying. And when they come to our program, we try and get them admitted as quickly as possible. And our physicians will determine what's going to be the most appropriate medication to prescribe them. The majority of our patients receive methadone treatment, but we also provide buprenorphine, which is also Subutex, Suboxone, things like that. And we also provide naltrexone treatment, or Vivitrol, which is the long-term injectable version of naltrexone.
Sure. And all of these just assist the individual that's addicted to come off of whatever the drug that they're on?
Right. So what these medications do specifically is they address the physiological dependence. And in combination with the medication therapy, we also provide substance abuse counseling and an array of other services that Operation PAR provides.
So one of the questions that I have for you is opioid abuse. Okay, I don't know a single person on the planet, unless they completely live under a rock, that hasn't even heard of this. It's an epidemic and huge proportions, certainly here in the Bay Area. However, it does seem that we've heard a lot of, because it is so recognizable and people are understanding that, so we've seen a reduction from, at least from the physician standpoint, so easily writing these prescriptions. However, we haven't been hearing as much about it. It isn't that hot button topic as much as it has been. So that's not to say that it's not still a problem, right?
It is still very much a huge
And very
problem,
present.
and it has been for a long time. It's just that it became dramatically worse over the last few years with the reduction in the pill mills around the state of Florida, and it turned into a situation where individuals who were previously relying on drugs like oxycodone and, and prescription painkillers that they could buy on the street, when the price of that went up dramatically as a result of them, cracking down on some of these really unethical physicians that are writing prescriptions, and heroin started making a big comeback because heroin was cheaper. Sure. And although most of the individuals that are addicted to opiates would prefer to take a prescription painkiller, desperation will kick in, and oftentimes they'll resort to heroin. And the overdose deaths have largely been caused by the introduction of fentanyl and fentanyl analogs.
Yes, now we've heard a lot about fentanyl.
Right, and so fentanyl being far more potent than heroin. And to give you a point of reference, heroin is about 4 or 5 times stronger than morphine, and fentanyl can be anywhere from 50 to 100 times stronger than morphine. And so individuals who, even if they have a high tolerance for opiates, if they mistakenly get a batch of heroin that is laced with fentanyl, they can very easily overdose. And that's what we saw over the course of, from 2015, 16, 17, this dramatic increase in overdose deaths.
So that's what you've seen. Talk to me just real quick about the treatment. What have you seen there? Does it really work? I know that's a big question for a lot of parents, a lot of loved ones of people with, is this really going to work? We've seen them go through therapy. We've seen them go to rehab and et cetera.
Treatment works.
It really works. Medication-assisted treatment is far and away the most effective form of outpatient substance abuse treatment there is. The difficulty is fighting the stigma surrounding medication-assisted treatment. Traditionally, substance abuse treatment has followed this abstinence-only model, and it makes sense to a lot of people. Whether if somebody's addicted to drugs, obviously they should just stop taking all those drugs, and hopefully the problem will fix itself. Unfortunately, people fail to understand that there's a difference between physiological dependence and addiction.
Sure.
Where the medication is specifically there to treat the physiological dependence, but it's the addiction that's really pervasive, and it takes a very long time to treat, and it's very complicated.
Sure.
So with the medication, what we do is we stabilize them so that they're not going through withdrawal, and make it so that they're no longer craving to use other drugs. And even if they were to try it, it wouldn't work. They wouldn't be able to get high.
So you're
off of
seeing
it.
success.
And we're seeing a tremendous success rate.
All right, I know you at home are wondering more. You probably have a lot more questions. We've probably piqued your interest at least. Well, there's the website that you're going to go to. It's going to give you all the information that we talk about here today on Bayside and then some. That website is CFBHN.org, CFBHN.org. Don't worry if you get lost, we can help you out at CW44.com. Don't go anywhere. We're coming back. Welcome back to Bayside. I'm your host, Shelley Sanders. I've been talking with John Essenberg of Operation PAR and, of course, Dr. David Clapp with CFBHN. And these guys are doing amazing things in the Bay Area, so I commend you. It is not an easy task at all, certainly as it relates to the opioid crisis, which is what we're talking about here today. Just one of the million things that you guys do here. But let's continue that conversation. You were talking about how, John, Operation PAR, how you medically help or medication-wise, medication-assisted therapy for individuals that are addicted and have become physiologically reliant upon these drugs. So when you're dealing with all of that, the first thing that comes to my mind after, thank God there's something available for these individuals, is, okay, you're talking about sometimes, in some cases, individuals that have lost everything because of this addiction and this crisis that they're in. The funding. Where and how, and is this where CFBHN comes into play, and how is that, how exactly do you tell legislation, hey, we're going to use this money for here, or do they tell you that? Talk to me about that. How does that work?
Well, the state of Florida has really stepped up over the past few years since it was recognized that we were having this crisis with opioids. So we've had 2 rounds of funding coming out of the legislature. One was the state targeted response, and our most recent iteration of that is called the state opioid response. Mm-hmm. Altogether, that's been about $33 million statewide. About somewhere between 8 and 13 million are currently targeted toward the Suncoast region. Yeah. So that provides the funding. If you don't have the ability to pay, we have the funding for you to get treatment.
Wow. And so what exactly are we talking about underneath the opioid umbrella of funding? In other words, what if you have something that's outside of those labels?
Well, we do have general substance abuse funding for treatment,
Mm-hmm.
but that actually is a really good question, Shelley, because the opioid funding is specifically for opioid treatment. Mm-hmm. And treating drugs and alcohol is always a moving target.
Right.
Once you think you've got something tamped down, a new drug will come along or a new trend will come along, and then
you were just talking about it with the prescription drugs, and then
right.
because they got too expensive, then the heroin raised its ugly head again. So I see how that can be the case.
So for some of your viewers, especially in our rural counties, what we're seeing is the trend that's coming up now is meth.
Goodness. Okay.
And so these dollars will not target that.
Oh no. So what do you do at that point?
Well, we use the resources that we have, but it's probably not going to be enough. Mm-hmm. So we need advocacy. We need people that will go out there and say this is a need. We need funding general funding for all drugs and alcohol, not simply target at a specific drug or alcohol.
Sure. So if I'm understanding you correctly, this is a big fat hint for those at home, right?
Yes.
So in other words, if you or a loved one have issues outside of the realm of what they describe as opioids, for example, if you find yourself with meth, so the advice would be to talk to your legislature, talk to even your city council, and go all the way up from there, right? Have a voice about it.
It's a way the public can become involved, have a voice, let them know what the problems are in your community that need to be addressed.
Sure. Fantastic. So without that funding, we don't get treatments like yours, John. Is
Right.
that correct?
So medication-assisted treatment within the state of Florida, we're able to bill Medicaid for it, but it's very difficult to get Medicaid in the state of Florida. We're one of the states that did not expand Medicaid, and as a result, 50% of our patients don't have Medicaid and they have to pay out of pocket. And for the individuals that can't pay and still are dealing with this crisis, they're very glad to have agencies like CFBHN to help us provide treatment for them with that funding. However, that funding might,
Right.
run out,
Right.
and so it's really important.
So for you at home, like I mentioned before, if you know or perhaps yourself are dealing with something, not only should you have a voice, but if you are dealing with something or you have a loved one that you need to get help, that's the website you're going to go to right there. They do have a service locator on that site. Scroll around and find the one that's nearest to you. If worst case scenario, call the number. They will point you in the right direction. We'll be back after this. Welcome back to Bayside. I'm your host, Shelley Sanders. We are continuing our conversation about CFBHN, Central Florida Behavioral Health Network, in case you're wondering what those letters stand for. Of course, we're talking with the incoming Chief Clinical Officer, Dr. David Clapp, and we're now joined by Jason Saffles. You are the housing coordinator for CFBHN.
Yes, ma'am.
Welcome to the show.
Thank you. Thank you for having me.
So real quick, I have to know, David, because there is, like we've talked about, and I keep saying it over and over again, it's so important and so amazing how many topics you guys handle underneath the CFBHN list of responsibilities, I guess you could say, your tasks that you tackle. So as incoming Chief Clinical Officer, oh my gosh, that's a lot going on over there. What are the challenges that you foresee ahead of you, or what is it that you're really looking like, oh gosh, I really got to tackle this first? What are some of those issues?
Well, Shelley, we have just recently finished our triennial needs assessment, and this is where we reach out in the community and say, looking around at your needs, what are the top 5 priorities in each community? And across the Suncoast region, hands down, the highest need was affordable housing. And that affects treatment. It doesn't matter what kind of treatment you're getting with Operation PAR, any of our providers, if you don't have a safe, affordable place to live,
Sure.
it's not going to be effective.
Sure. And I can understand how that would just compound the problem. If now I can't afford my bills, okay, I might as well just go get high or whatever it is that you give yourself an excuse for, right?
Yes.
So it compounds the issue. So perfect opportunity for you to step in and talk about it.
Absolutely. And like David said, without a safe, affordable, permanent housing, it's hard for someone to focus on that recovery aspect of their life, because all they're thinking about is, how do I get through the night? Where do I sleep? Where am I going to get water? Where am I going to get food? So those recovery things become very secondary to survival. It's very, having that safe, affordable housing and that permanent place to stay really gives you the edge for potential to be successful in recovery.
How can our viewers help out in that situation? What can they do for someone who's watching thinking, you know what, I've been there, I understand that, how can I help?
Right, every community has a homeless coalition and a homeless continuum of care that is open to the public. They're welcome to come to those meetings. You can, just in your local area, put in what county you're in. So you can put Polk County Homeless, Pinellas County Homeless Coalition, Hillsborough Homeless County Homeless Coalition. It'll come right up and it'll give you the dates for those meetings, and that's a very great way for advocating.
And if I could just put a plug in too, if you're a landlord out there
Yes.
and you are willing to work with the people that we are serving and be flexible and work with our providers, and we need you.
Mm-hmm. Okay, well, you heard it from the man himself, Dr. David Clapp. Thank you guys both so much for that input. And of course, you can find all this information and then some right here on the website that you're looking at right there, cfbhn.org, cfbhn.org. Don't forget, they do have a service locator on the site, so if you need help, If you have a loved one that you need to get assistance for, by all means, log on to that site and navigate around till you find it. All right, we'll be back after this. As always, I want to thank you at home for joining us this week on Bayside, and of course, thank you both for being here, and John too. And if you at home, if you need help or you'd like to help, if you want more information at all, I encourage you week after week to get involved in your community. This is where you live. Log on to CFBHN.org and navigate around the site. It's very informative, and I think you'll find a lot of success there. All right, for now, I'm Shelley Sanders. Have a great rest of your week.